started. All right, good evening, everyone.
Good evening.
First, I want to thank you for coming out and taking time out of your busy schedules to hear what we have to say about sciatica, and hopefully you can learn something tonight. Let me introduce myself. I'm Scott. I'm a physical therapist here. This is Eric. He's going to be, he helped set up everything, and he's going to be our assistant tonight. First, I'll give a little introduction about myself. I got my undergraduate degree in exercise science from the George Washington University in DC. And then I received my doctorate in physical therapy from NYT, right here in Old Westbury. So this is Farmingdale Physical Therapy West. We've been here for about 5 or 6 years now. The past 2 years, we've won Best of Long Island. We've been nominated and voted to win by all you patients. Some of you I see in the audience look familiar. A couple of you I've worked on today already. So thank you for coming back a second time today. Shows how much you care about getting yourself better and being here. Also, you have worksheets with you, some information about something you can follow along with and fill out. The goal of the evening is to be active participants, and this way, you can participate in what we're doing. It's not just going to be me speaking the whole night, and I don't want to do that either. So, all right. Everybody have a pen and the worksheet with them?
Sure. Yes.
Okay. Also, with the Best of Long Island, we're doing voting on that right now again, so there'll be some forms up front to explain to you how to vote so we could win for the 3rd year in a row. All right. So tonight's lecture is going to be on sciatica. So everybody's got their pen and the worksheet. Now, I thought a good idea, just to get people, get things going, is give a short quiz about sciatica and see what you all really know. Now, does anybody think they have active sciatica right now? Okay, good handful of you. All right, so first thing we're going to discuss is what is sciatica. Now, first let me ask a few true and false questions. With sciatica, do you think everyone experiences similar sciatica symptoms?
No.
Correct, that's false. Good job. All right.
That was easy.
That was an easy one. Is sciatica a medical diagnosis?
No.
Correct. Yeah, it's technically not a medical diagnosis. Okay. Does anybody know what the medical diagnosis of it would be called? All right, so lumbar radiculopathy. Okay. Now, when you have sciatica pain, sometimes people are unsure if it truly is sciatica and if it's a medical emergency. Now, I'm going to go through about 4 or 5 different things, and you tell me if you think it's a medical emergency. If you experience sciatica and you have bowel and bladder incontinence.
Yes, medical emergency.
Correct. Progressive weakness and loss of sensation in one or both of your legs.
Yes.
Correct. Symptoms that occur in both of your legs.
Yes.
Correct. Symptoms that occur following an accident or trauma.
Yep.
Correct. Symptoms that occur in tandem with a fever or loss of appetite.
Absolutely.
Okay, so those are all medical emergencies. Because typical sciatica only affects one leg. If you know it's straightforward sciatica, it's not a medical emergency. Although we still don't really get into what sciatica is, that's just one of the important things you should know. And now, last true or false question: rest is typically better than exercise for sciatica.
I think that rest would be better. It's probably wrong, but for me, it's
that's
true.
false. I finally got you at one. You've answered every question right except this last one. So that's
But I knew I was.
yeah. Believe it or not, even if you're having excruciating pain down the leg, for the first maybe 12, 24, 36 hours, you may need to rest and ice and take some anti-inflammatories. After that, it's been proven that the best treatment is actually movement and exercise. That's why the best conservative treatment is actually physical therapy for your sciatica pains, because we know how to tell you how to move and what to stretch and what to strengthen to help alleviate the pain. All right, so now we get into the meat and potatoes here of what exactly is sciatica. Anybody want to take a guess?
Inflammation of the sciatic nerve.
Yeah, very good. That's sciatica is typically an inflammation of that nerve, and it typically causes pain down one side of the leg The sciatic nerve is actually, 5 nerves come off the bottom part of the lumbar spine, and it forms the sciatic nerve, which is actually the size of the adult human thumb. So it's pretty big, passes right through one of the hip muscles called the piriformis. You may be familiar with that. So sometimes if the sciatic nerve is inflamed, it could be pinched on the piriformis, which is one of the hip rotator muscles. Or if the piriformis is in spasm, it could press on the sciatic nerve. Both kind of reproducing similar types of symptoms. So kind of as the physical therapist, we have to be like a detective and see, is it coming from the piriformis or is it true sciatica? And what exactly is causing the pain. So now we know sciatica is that inflammation of the nerves coming down the pathways. Actually, just to mention more of the anatomy, when the sciatic nerve comes down the back of the leg, right when it hits the knee, it splits into 2 nerves, the common peroneal and the tibial nerve. So technically, you could have symptoms all the way down to tingling into the toes, but technically that's not the sciatic nerve that's inflamed down in the bottom part of the foot, but we still call it sciatica. And that being said, the true medical terminology is a lumbar radiculopathy, which that means it's a neuropathy of the nerves coming down the legs, causing the numbness, the tingling, the pain, the weakness. And like I said earlier also, sciatica, just so you're not confused if you think you do have it, is always in one leg, 99% of the time. If you have it in both legs, you really need to get checked out. Like it said, it could be a medical emergency because it could be related to something else. Okay. So, what are some other things that may cause sciatica in the human anatomy? Anybody have any guesses?
Weight.
That's correct, yeah. More excessive weight on the lumbar spine could cause more pressure on the nerve. Anything else?
Disc problems.
Exactly, yeah, this
When
is
you don't
what,
have any discs.
yeah, this herniated discs is what I wanted to mention, the next thing. So you've heard that term before, herniated discs. There's also a lot of other terms that get thrown around. Ruptured, slipped, pinched nerve, compressed nerves. Those actually all mean kind of the same thing, and you may hear some of your neighbors or friends throwing out like, I slipped my disc or this or that. Technically that's not a medical term either. The disc either herniates, first it could bulge, and then it could herniate. So if you picture like a jelly donut, some of the inside of the donut might come out, a little hole, then it pinches, could infringe on some of those nerves coming out the bottom part of the spine. So then as it comes down to the sciatic nerve, it gets hot, it gets inflamed, and that causes pain. Another thing you may have heard of is lumbar stenosis. That is very common as we age, probably over 55, 60 years of age. You get narrowing of the spinal canal. So there's less space for the nerves to pass through. So that could also cause the inflammation on the sciatic nerve. And then another common issue is degenerative disc disease, which they call it disease, but it's not really disease. So people hear that term and they get very nervous. But again, that happens with the aging process. So the shock absorption that the discs are supposed to do, they don't provide the correct shock, and then could also cause inflammation and make you more susceptible to bulging and herniations. All right. Now I saw a few. Okay, that was kind of the anatomy of the back and the sciatic nerve. Now you may have a little better idea on what causes sciatica. There's also a lot of different layers of muscle in the back. Anytime there's a inflammation or radiculopathy in the sciatic nerves, you could get some spasming in the erector spinae, multifidus, some of these big, thick back muscles. They kind of get out of whack because they don't know how to respond to what's going on with the nerve pain and the slipped discs. Then you kind of can get a pelvic shift. One side of your pelvis could be higher, your leg lengths could be off. This is all, as I mentioned before, about being, physical therapy is more like an art. We have to be more kind of detective and see what exactly that's pain, is causing, what the sciatic pain is being caused from. Are your hips shifted? Are your muscles off? Is there herniated disc? Is there stenosis? These are all things we have to look at. Now, I saw a bunch of hands go up of people thinking they have an active sciatica. So I'd like everybody to, if they can, if you feel like you are able to participate, we're going to stand up and we're going to see if we can reproduce anybody's pain. Because I'm also going to need a volunteer, somebody that could wants to get a kind of a free, short but sample evaluation and treatment session tonight. All right, so whoever wants to participate, you can stand up. Now, the main goal is, I don't want anybody to hurt themselves. All right. Now, everybody who pat their heads and rub their stomach and say, no, I'm just kidding.
I was gonna say, come on, I can't do that.
It's not even said.
Yeah. No, all right, so who's ever standing, we can kind of, if you think you're having sciatica pains, we can kind of see where the pain's coming from just by 4 different easy movements. Put your hands on your waist. Try to lean backwards. Tell me if you get any pain. Good. Lean forwards. Try to touch your toes. Nice and slow. Barry, I don't want you doing that. Cause any pain or tingling down one leg?
No.
Just tightness?
Nope.
Okay. Put your arms over your chest. Now don't move the hips. Just move at the hips. Look back over your left shoulder. Any pain? Look back over your right shoulder. Any pain? Good. Put your hands at your side. Reach to the left knee. And then reach the other knee. Any of those sideways movements cause any increase in pain?
Nope.
All right, good. Now also on the worksheet we had, I want everybody to put down a scale of 0 to 10. If they think they have active sciatica or pain right now, put down a 0 to 10 what your pain level is. And then let me know if you think it's high. Over the last few days or even today, what's your worst pain is? Anybody up in the 5, 6, 7, or 8 category?
Yeah.
What number? Marty, you're like a 15 out of 10, I know. Well, you can't get treated with that hat on. Okay. What level? What number do you think you're at?
This second or during this past
The past
week?
couple of days when you've been having pain.
7.
7?
It's up to 7 sometimes, yeah.
All right.
On my left side.
All right. Okay, good. All right, so everybody have a seat. So the good thing is, sounds like nobody really caused any pain or numbness tingling down the leg when they were doing any of the movements, which is good. That's not to say, you might not have something else be causing your pain. So what's the best way to avoid getting sciatica type pains? Anybody? We kind of discussed before a little bit. You in the back?
Exercise?
Correct. Good answer. I know you don't do any though, so. All right. So the best way to prevent sciatica is to have your back muscles, your core muscles. You probably heard that before. Your core muscles, your back muscles, and your legs all have to be strong, and you have to be in good postural alignment. Now, that's why we're trained professionals to teach people how to be in proper alignment, how to exercise, because most people think they exercise and they're doing things the right way. But trust me, when I've asked people, just show me some of the things you do to help strengthen your back, what they're doing is actually making it worse. Some of those examples would be like military-style crunches, or if I say how you strengthen your back, they say, well, I walk, but that doesn't involve any core strengthening. So how many of you actively exercise right now and think you're strengthening the core? Okay, good. Maybe about 3 or 4 of you. All right, so I'd like to bring up a volunteer who wanted to get the evaluation and a little treatment and do some exercise. You sound like a good candidate.
Sure, why not?
What's your name?
Suzanne.
Suzanne, okay, good.
Thanks.
All right, also, yeah, I forgot to mention at the beginning of this, the first 15 people that signed up, again, we want to thank you for coming by. You're going to be receiving one of these contour lumbar cushions and a nice stick of BioFreeze. Some of our patients like to bathe in this stuff, so it really.
Well, it works. It really does.
Yeah, so it'll be good. And then we sell some up front also as well, so you can always pick some up anyway. All right, so we're gonna go through a quick scan evaluation of her posture, her pain, and her sciatica. So how long has it been bothering you for now?
20 years.
Okay, so
Yeah.
that's
I'm a
quite-
long-term patient.
Yeah, chronic pain. So
Degenerative disc disease.
okay, you've had an MRI. Okay.
I'm one of
So
the
you have the.
long-term patients.
Oh, okay, good. I don't think I remember before though.
No, we haven't.
All right, so it's not a fixed. Hasn't been set up. All right, let me just check out your posture. Which side, when you have sciatica, does it typically go down?
Always the left.
Always the left? Okay, so that's common. Typically, chronic sufferers of sciatica is going to have one side of pain. So what I'm going to do, I'm going to scan the spine for any scoliosis or any changes. I'm going to check her hips.
You're uneven.
Yeah. Right now, the right side looks a little higher. So if something's pulling over here, the muscles are imbalanced. Probably what's happening is, as a result of this chronic sciatica on the left side, she's doing which is very common, a lateral shift. So right now she doesn't look too bad, but probably when she gets bad pain, she shifts a little bit because she's trying to take pressure off the sciatic nerve. That's how people get out of pain. Same with stenosis. You see some of the elderly people walking around like this. When you have stenosis and really bad stenosis, going into a flexed posture actually alleviates the pain. Even though we don't want people standing in poor posture, they do that to get out of pain.
Without even thinking.
What's that?
So I'll do that without even thinking.
Yeah, you do it. It just happens naturally. People don't think about it. So, our goal of our treatment is going to be to shift her back straight, get rid of the inflammation and the pain down the leg, straighten out the hips and the pelvis, and strengthen the core. So you are doing some exercise actively now, or not really?
Ooh.
Okay.
I do not exercise regularly.
All right.
I'm
Also,
supposed to.
yeah, we're gonna have to get you going then.
Yeah.
I'm actually gonna show you 3 or 4 exercises and 3 or 4 basic stretches that you can start doing every day,
Good.
as long as it's not in pain, not causing any pain. So part of the evaluation, I would check her range of motion. I would check some muscle strength. It's very important that I compare the right and the left legs, the strength, make sure there's not any weakness, because that's more.
Pardon me. Sorry, Dave.
Oh, sure, no problem. That could be more of a serious issue if there's progressive weakness on the left leg from the sciatica, especially if you ever heard of like a foot drop, a weakness that doesn't allow you to move your feet well. It could affect your walking gait. Do you feel like you feel weak in the left leg?
No, I have burning pain though.
Just a
down
burning pain?
to about here,
Okay. All right.
which isn't too bad.
Do you have
It goes right through my SI joint, the pain goes,
Okay.
and then down to about today.
Yeah, so also another thing could be a sacroiliac dysfunction. Is that hurt in there a little bit?
Yeah.
A little tender?
Yeah,
All right.
right when you hit the SI joint.
All right. So a sample treatment, just, this way everybody can understand what we typically do. For some of you who aren't active patients, generally speaking, she'd be getting, because it's chronic heat, electrical muscle stimulation, ultrasound therapy, laser therapy, massage to loosen up some of the tight tissues. I definitely felt a lot of tightness in there just from quickly palpating. And I would probably have you on your stomach, check out the sacrum and the hips. After we did all that, we start exercising as long as it's pain-free. So Eric, I'm going to ask you for assistance here. We'll get you lying on your back, facing up.
Okay.
We're going to let's start with the core exercises. Okay. Let's get, number 1, never lie completely flat like you're in a coffin, because that actually, you should always have one leg bent, because that could actually cause strain on the lower back. Believe it or not, something so simple as that could flare up the sciatic nerve. All right. Now this is, if there's one exercise you're going to focus on. Question?
What about bedtime? Sleeping? What do you do?
Yeah, you don't want to you should always have pillows, yes, pillows
Put a pillow
underneath.
underneath?
Yeah. So you've been trained well before in this, which is good. Some of it's stuck, man, just sticking with the exercise part. This is probably the most important, if you're going to do one exercise, although I'd like to do more than one, this is probably the most important exercise you could do. It's called a posterior pelvic tilt, and tucking your belly button down into your spine. So you're going to move your hips this way and get your back flat against the table. Perfect. And as you do that, you're going to picture your belly button being tucked into your spine. You can hold it 1, 2, 3, and relax. What that does is it helps, you're probably wondering what that does. What it does is it helps strengthen the transverse abdominis muscles. You have your rectus, your outer layer of abdominal muscles. Those look nice. You see people in bathing suits where they have the abs coming out. That actually doesn't really provide the core stabilization. It's the transverse ones and the obliquus that provide the core stabilization for the spine. So this is something you could start doing at home. Pelvic tilt. Your back has to be flat, meaning there should be no space. I shouldn't be able to fit my hand through here, underneath her back. All right. Now, how we do that here, so you know you're actually working, you want to show her the what's called the lower abdominal exercise. So, and the great thing about this is, I'm going to show how it works. So we actually use blood pressure cuff, so we can measure the strength of those muscles, and then we could check on your progression week by week.
Come down.
He's going to pump it up to 40, right?
Yep.
He's going to pump it up to 40. She could look at it, hold it, and then as she contracts her stomach muscles, we'll see it go up to 60. Now, yeah, between 60 and 70.
Perfect. Yep. Perfect. You good?
So now this posture of keeping your belly button tucked into your spine and your back flat, that doesn't just go for laying on the table. That goes for whatever you're doing in your daily life. Whether it be picking up something from the floor, standing, walking, driving, any exercise you do, you have to maintain the core being tight. Now why is that? Because when the core is loose and those muscles aren't firing, if you go to, let's say, bend and twist, which is probably the worst movement you could do, and the core is weak, that's how you end up with a bulging or herniated disc.
Yeah.
So, and the reason why that happens is because the discs are good at shock absorbing, so you could jump high, as long as it's not degenerated, the disc. You could jump, and they're good. They're able to protect against jumping forces and cushioning forces, but the discs are not good, and they're not built well to protect against rotational forces. That's why people just bend over and pick up a pen from the ground, and they get stuck and their back goes out.
Yeah.
That's a classic way you get sciatica. So if you're picking up something even as light as like her shoes from here, if I went to bend and twist from here, that's how I'm gonna hurt my back. I have to face it, and I could bend down like this, keep my stomach tight, or I could do kind of a golfer's pickup. But you never wanna, you gotta have the item, you gotta have whatever you're picking up facing you. Otherwise, it could be one bad rotation, and if you're weak from herniating a disc, and then you'll have sciatica for 6 to 12 weeks. Until you come see me, and then I'll cure you one day. All right, how's that exercise going?
Cool.
Yeah, it was a good one.
Yeah, it's a good one.
Now, so that worked the stomach muscles, and now probably the best exercise you can do for the actual back muscles is bridge. You ever do a bridging exercise before?
Yeah.
All right. Yeah, so you want to go flat. You can still have your head on a cushion. Oh, no, not like that.
Not like that. What are we doing?
All right,
Just
let's
this
show
way.
it. Yeah, exactly.
All right.
Hands flat.
I can do that.
You hold 1, 2, 3, but you want to squeeze your glutes and your lower back, but you also want to keep that belly button tucked in. So now this exercise works the hip extensors and the lumbar extensors, the back muscles. So we've done something for the core, the stomach muscles. Now we're doing something for the back muscles. Let's do 5 of these. Now these painful. Ideally, you want to do 33
No, I'm just
sets
trying
of
to
10.
focus on doing every muscle group that you
You're
said.
you're under pressure right now.
Under pressure. The back and the belly.
What if you're doing these and you're experiencing the pain? Like
Yeah,
how is
so,
it supposed
yeah,
to
that's
come out?
good question. If you're having pain, you have to stop. You have to tell me and we'll go over what you're doing. There's a lot of different modifications to these exercises, but I have to see the way you're doing it and what's happening. But number one rule is if it's increasing your pain, if you're having pain and it stays the same, you can keep doing it. But if it's increasing, if it's causing you to go from a 7 out of 10 to a 9 out of 10, then you got to stop. Because then either it's not helping or you're not doing something right.
And when you go down, do you just relax everything?
Yeah, on the way down you can relax, but you still want to keep the belly button tucked in.
Even
It's
when
fine.
you're...
Yep, even when you're flat. Yeah. That's,
Well, that's easy then. Keep that tight the whole time.
yeah. That goes for just, like I said, cooking something in the kitchen, whatever you're doing, it's gotta be, belly button's gotta be tucked in, especially if you're somebody like yourself with a history of the chronic sciatica. I know you don't want to, have that pain again.
I have it all the time. I walked up the stairs to come up here and I got the shooting pain on my leg just coming up the stairs.
Yeah. All right. All right. And we got a third exercise. You want to show her the straight leg raise?
All right. So one leg, keep this leg bent, this leg straight.
Okay?
Okay. Of course, tucked in.
Right.
Lift your leg to this height.
keep your toes pointed to the ceiling.
The ceiling.
Yep.
2 seconds and come back down.
Now this is another great core stabilization exercise. Most people are weak with this. By the time they get to 10, the leg might start shaking, their back might come up off the table. You have to maintain the back flat on the table, belly button tucked in, and 3 sets of 10 to make 30. Now if you could do this, if you could do these exercises without pain, and you start progressing and they get really easy, then we would progress you to the next set of exercises. But we can't really do that until you've kind of mastered these for your core. That's why you see
Count to
people.
10?
Yeah, hold it for like 3 to 5
Yeah.
seconds and bring it down slow. Right, about an inch to the table, and then bring it back up, toes to the ceiling. How's it feeling?
Okay.
All right, now it's the left side that's the issue, so
Oh, yeah.
we'll see how it does on the left side. We want to make sure it doesn't reproduce any pain. All right. Again, while she's doing this exercise, something else I want to remind you. Another common cause of sciatica that I didn't mention is prolonged sitting. So, sitting actually puts about 3 times more compressive forces on the lower back and the discs than standing. We weren't really meant to sit. We were built to be standers and squatters when we need to, not to sit. So, I tell people who work at desk jobs that they really need to stand up every 15-20 minutes if they're having back pain, or even if you're not having back pain, because again, that causes more compression on the discs, and as we discussed earlier, the compression on the disc could cause a bulge, could cause some inflammation onto the nerves, and then you get sciatica down the back. How's it feeling on the left side?
The first one.
All right.
course,
And
okay.
ideally, we don't want it to trigger any sciatica pain.
So you were right, it got very tough by the time I had to do 9 and 10.
Yeah, it was a little
On
shaky.
the first side, yeah, it was
Yeah, see,
definitely
these
shaky.
are 3 exercises, especially based on your history. These are a quick history that you should be doing every day. All right, so those were strengthening exercises. Now, when you have this active sciatica pain, you could be getting the muscles could be pinching on the sciatic nerve. So I'm gonna start, you can relax now. Great job with the exercise. I'm gonna start stretching you, and then I'm gonna show you how to do the stretches yourself. Since you were willing to volunteer. Okay, but now I'm gonna stretch you nice and easy. This is a gentle knee to chest stretch. Stretches the low back and the glutes. Just don't let anything cause any pain. Then we go into a little bit of hip stretching. This one's generally really good for people because as the pain's coming through the hip and the piriformis, it gets really tight. This helps release it. Then we bring it over like this. We always work on both, even though her pain is typically on the left side, well, it's basically always been on the left side for the past 20 years. We always do everything on both legs to keep you balanced. Stretching feel all right?
Yes.
Now I just gotta go, we're stretching the hamstrings, but I gotta go easy with the hamstrings because that could actually reproduce some of the pain. This okay?
Yes.
All right, good. Now while you're here, I want to check your leg lengths. Okay, bend your knees to your chest.
I'm usually uneven.
Yeah, so as suspected, you can see right by here, the left side on the leg length is a little higher, about a half an inch on the left. So it always is like that. So the tightness on the left piriformis and the hip here is pulling up the leg. So we kind of see what's off balance. We would definitely do some mobilization on her. I put the hips kind of back into alignment. Usually there's something I do with Kathy back there and it helps after she leaves. She's always feeling better. Right?
Absolutely. 100%.
Yeah. And we would do some different mobilization. We do some distraction on the legs. All these different techniques help free up the nerve and gives us more space. Because not, like I said, it's the size of your thumb, but it's sharing the space with a lot of other tendons, ligaments, and muscle tissue. So releasing all that, usually, well, if you're maybe a 5 to 8 out of 10 pain, you could get down to 2 out of 3 and stop functioning. Usually you're able to now sleep better through the night. because that can be very debilitating. All right, so Eric, let's show her these stretches to do at home. We're gonna do the piriformis and figure 4 stretch. Now I'm gonna show you guys 3 stretches you could do at home if you're experiencing the sciatica pain. And again, the same rule applies, like she mentioned. If any of the stretches cause more pain, then you have to stop. All right, you want to show the knee to chest first?
All right. So we bring this
Single
knee
knee to chest.
Single knee to chest. You do that side. Okay.
This is like,
You grab the knee, pull it into your chest, hold it for 10 seconds.
10 seconds, 10 times. Knee to chest, very simple stretch, but it's 100% safe, and it should free up some space in the nerve. Yeah. There's a little, you feel a little bit now on the left? All right. All right, what's the next?
what's the next stretch?
Show her, you want to show the piriformis? Show her, yeah, knee to shoulder. So you're to grab with your right hand. Yeah, well you could do this one. Bring this up. This is called the figure 4. Go between the hole here. This one looks a little more complicated, but once you get the hang of it, it's a great stretch.
Can you do
Question?
it without the hands?
You can use a towel.
But can you do it without it? To get
No,
the
because then you're not relaxed. You have to use the towel with your hands.
Hi, Scott.
Hey.
When I do those leg exercises, the back of my thigh seizes and I'm in terror. The muscle feels like swelling and locks.
Okay.
in the back
It's
of my
different
thigh.
than the sciatic pain. Is it more just it feels like a muscle cramping?
A muscle cramp.
All right. Well, that could be.
I've heard of those, but
Yeah, you may have some really direct tightness in the hamstring, you know, the back of the leg muscle. So that could be a separate issue from the sciatica. So that tightness could be preventing you from doing some of the sciatica stretches. So if you came in for treatment, then we have to release the hamstring first to allow you to do some of these stretches, then to get to work on the nerve.
because I have had epidural shots and steroid shots.
Yeah, you've been through it all.
Through it, yeah. It's severe sciatica.
Yeah.
And my spine from the neck all the way down.
Yeah. So that's. Yeah. Well, I mean, the main thing would be to avoid surgery.
Yeah.
Because it actually, the long-term studies and long-term outcomes of surgical versus non-surgical treatment for sciatica are exactly the same. So it's sometimes it could give you some more immediate relief, but the long-term outcomes it's not necessarily going to work. So
These exercises cause damage.
they could hurt.
It hurts when they do it. In other words, if I push myself through do that, would I cause more?
Technically, I would tell you not to do it if you feel the pain getting worse. Technically, you really couldn't cause more damage, just causing more inflammation because you're not able to do it, and your body's saying, kind of, what are you doing to me? But you technically can't really cause damage because they're all safe exercise and stretches. All right, and then we just got to show another quick one is the knee, left knee to the right shoulder, just like that. Yeah, this helps just release the hip and the piriformis again. So again, this is another question on the worksheet was, what is core stabilization? This is pretty much it to keep the lumbar muscles and the back muscles and the stomach muscles strong. So if you do get yourself in a precarious position where you might herniate, the muscles kind of take over to protect the spine, the inner core muscles. And the better flexible, more stretched you are, the better you're able to move, and the more you exercise, the less chance you have of getting sciatica. It's always the people that return with the same sciatica symptoms. I say, did you do redoing your exercise? And they, 9 out of 10 times it's no. Pretty much, actually, that happens every time. I don't think anybody's told me the exercise and they came back with the pain. So these are kind of the beginning exercises, and then we progress you. Now something else that we have here that's unique to our office at Farmingdale Physical Therapy West is the anti-gravity treadmill. So like I mentioned earlier, the best treatment, which some of you weren't sure about for sciatica, is actually movement. Not sitting, not doing nothing, because that just makes it worse. But you may not be able to walk because it may be too painful. So you're going to say, well, Scott said I got to walk and do this and that when I have pain. but it might cause more pain. But what we have here that allows us to kind of get you better faster is that anti-gravity treadmill. Is anybody here familiar with it?
My husband was telling me about it. It
Yeah.
sounds cool.
So what it allows us to do is using NASA technology, kind of mimicking like being in outer space. It seals in your bottom half, and we're able to set you down to as low as 30% your body weight. So if you weigh 100 pounds, we're able to get you walking and moving and even running at like as if you weighed 30 pounds. It go from 30% all the way up to 100%. So there's only a couple facilities on Long Island that have this, but every major pro sports team has one because it's great. It's great for athletes to rehab from also, but could also be utilized in treating sciatica as well. So if somebody comes in with sciatica, they say, well, you want me to walk and move, but I can't. I take, I walk for 5 minutes. I have to sit down because it hurts too much. Then we put them in there. They're able to walk and move for 20 minutes. They come out. Now they feel a lot better because the body's starting to get reacclimated to movement. So as I mentioned earlier, the real treatment for sciatica is actually movement, correct posture, and just doing things the right way. Any questions about the Alter G?
That's what it's called, an Alter G.
The anti-gravity treadmill. I think we have flyers for it up front, so if you want more info on it.
There's flyers in the folder.
Oh yeah,
Yes, there is in mine.
there's flyers in the folder about it. All right, so
You done with me?
yeah, thanks. I think you need to go
Very
tomorrow.
Yeah, I need a prescription first.
Yeah. All right. Now I'm also gonna stick around for some more questions. Then yes.
You said she needed a prescription first. Is that accurate?
Oh no. What's your insurance?
United Healthcare.
As long as you're not on Medicare, we could see you direct access for 30 days, for a month, or 10 visits, whatever comes first. So yeah, technically you just come in tomorrow morning if you want, and we can get started with treatment.
So you're saying Medicare doesn't cover it? Medicare doesn't cover that?
Medicare doesn't, no, technically Medicare doesn't cover the machine. We got it because it helps our patients. We don't get any extra thing out of it. It actually costs a lot of money, but we have it here because it's beneficial to you guys. Yeah, and I'm really just gonna stick around for questions.
Scott, do people with sciatica have a tendency to hunch over?
Yes, that's typically stenosis.
Okay,
But yeah, sciatica, more like a lateral shift.
sure.
Like she has when she comes off the left side a lot, because typically sciatica is to one side. So if you're herniated to the right side and you get a pain on the right, you're going to shift like this.
Yeah.
So, you see people walking around like this.
Yes.
I'm kind of exaggerating a little bit, but actually I'm not if you're in really severe pain. Yes.
Scott, if you have a balance issue, can you go in the anti-gravity machine?
Yeah, good question. Actually, the anti-gravity is also great for people with balance issues because it's 100% safe. We zipper you in. You wear, just put these shorts on. We help you get them on, and then you just get zippered in. So for people that with balance issues that are 100% not safe on a regular treadmill, going on there, they're 100% safe. We don't have to worry. That being said, we'll have somebody all the time stand with you and guide you through it, but you can't get hurt in there. You guys have a question in the back? Okay. Oh, for tonight? Okay. So now, back to the pain scale. I know some of you sound. Oh, you had a question?
Just about the hamstring. I have trouble. I injured my hamstring a long time ago. It does cramp up on me.
Okay. How did it happen?
And I had sciatica. I just slipped, fell and ruptured it, the whole back of my leg.
Okay. Yeah. No surgery though, right?
No.
Yeah,
I
just
got
kind of
these
heal. That's what they.
pads and ultrasound, you know.
Yeah. So in your case, kind of scar tissue falls around the torn part of the hamstring. The rest of the muscles kind of readapt, but again, so it shifts. Your whole body kind of shifted and compensated, which probably is what causing your sciatica pain. So, when you came in for the treatment, we'd see what's weak, what's tight. Really have to work on the hamstring and then kind of treat both.
Back in 56, and the piriformis muscle.
Yeah, so.
It comes all the way down, and I got a drop foot from it.
Right, so
a lot
that's.
of treatment and everything, and I got it back a little bit. But they wanted to do surgery, but he said, he was honest with me. He says, at your age.
Yeah, well, it was good.
Yeah.
Luckily, that was a good choice.
I think
And now, Yeah, part of the treatment would be evaluating what's tight, what's weak, and kind of rebuilding everything, keep you in level. Yes, Marty? The arthritis? All right, yeah, well, a lot of people, good question, you'll get an x-ray of your lower back. You know, x-ray doesn't show soft tissue, but it can show arthritis in the lumbar spine. Arthritis, you know, painful condition, affects the joints. Best treatment for arthritis is also exercise and strengthening, so you keep the joints strong. And then a lot of modalities like ultrasound, stimulation, hot, cold to kind of alleviate those pains. All right, now back to the pain scale. I know some of you were in kind of 5, 6, 7 range, having some pain. Because you took the time to be here, and you know, we really appreciate it. Wondering who's going to be able to stick around tomorrow or schedule an appointment either later or for the rest of the week. We got.
I don't need a prescription.
All right.
I'm up.
Yeah, you don't need a prescription. We got a few. Some of you I know are already active already, so I'll probably be seeing you later in the week. All right. So, anything else with today? Just listening by the highest on the pain scale. Yeah. So again, we have everybody up front. You could schedule appointments with them. Now I want to, because there's a decent amount of you, about 20-25, I want to dismiss everybody by their pain scale. So if you're having a 10 out of 10 pain, you could go, and we could watch you walk out of here in pain. 9 out of 10? 8 out of 10? 7? Marty, you 6? 5? All right, then everybody just go at your own.
Thank you very much.
All right, thanks for coming.
Thank you. Thank you.
Hope that was informative for everybody.
I got some questions.
That's why, yeah, I'm going to stick around anyway for some more questions.